Just breathe. Just breathe.
What a great song. That's American Idol star David Archuleta's new music video for his song, Just Breathe. And if you recognize that scene from the hospital, it was actually from our own Valleywise Health Medical Hospital, clapping for a patient who had recovered from COVID-19. Now this weekend, Arizona kicks off a testing blitz, and the Department of Health is teaming up with several healthcare organizations to provide statewide testing, and their goal is to test between 30,000 and 60,000 people over the next 3 weeks. So we're checking in with Dr. Michael White from Valleywise with what we could learn from this testing. Good morning, doctor. Thank you very much for joining us. And is that possible, that number that they're trying to achieve?
It is. If we set up the testing sites, throughout the state and have a good process about how long it takes. So as a person were to come to one of these testing centers to be able to obtain the nasopharyngeal swab, basically a long Q-tip-like device that'll go in the back of the nose all the way back to the throat through the nose. To take that really takes just, a few minutes to obtain that sample. So if we have a large number of stations and a large number of people that are able to obtain those samples safely, we could certainly get to that number that the state is looking for at 30,000 per weekend.
What kind of information are we hoping to obtain from all these tests?
What we're hoping to see is how many people in the community that truly may be asymptomatic carriers of the novel coronavirus or that virus that is causing COVID-19 disease, to truly give us an understanding of what the prevalence is of this virus in the community, because that lets us be able to predict those that may have already been infected or may be carrying it, and we can give them instructions to stay isolated even longer so they don't risk transmitting this to others, even though they may not feel sick.
All right. I'd be remiss, doctor, if I didn't ask you, how are you and your staff doing, especially after what we saw earlier this week, an ER doctor out of New York who took her own life? And I know this has been very stressful for you guys.
It has been very stressful, but I couldn't be more proud of the team at Valleywise Health and all of the healthcare professionals across the valley. I think everyone has stayed remarkably engaged, really supportive of one another. Really, the communities all around here within Maricopa County and the state of Arizona that have rallied around the healthcare workers to make sure that they are supported and feel that support from the community by, staying at home, doing things that they can do to reduce the transmission, so we don't see that large, overwhelming sensation that they have seen in other parts of the country, which would truly put increased stress on all the healthcare providers. Our teams have been doing wonderfully well.
Are we starting to see it kind of stave off at the Valley hospitals?
We're kind of staying steady. I like to say we're kind of sort of staying steady. We're still seeing cases that come in every day. But again, we've not seen a huge, large influx all at once to overwhelm the resources. So again, this is a virus that we don't know how long it will stay with us. Probably going to stay in our community for quite some time. If we can understand that we'll, have some patients that had this, throughout the summer months, without that large spike, we'll be able to accommodate that and treat those individuals.
All right, doctor. Well, we want you to take care. We want you to be careful and send our love to the rest of your staff. But I want to show you this. Pay attention to your screen right now, because this goes into what we're talking about just, thanking our first responders. So last week, HandsOn Greater Phoenix collected hundreds of thank you notes and people from across the valley. And we know they were delivered to some of the doctors and nurses at Valleywise. So we want to take a look at this video right here. Check this out.
Really nice.
Frontline rock star.
Oh, I like that one. Get that one.
So cute. Oh, cute. Look at that.
Such a very special moment, and we can't say this enough. Thank you. What was that like for you and your staff?
The team, again, was just incredibly grateful for all the support that we've had throughout from the community to really recognize the the reason that many individuals work in healthcare is they've been called to help others and then called to serve others around that. And to see that recognized in this time of, great uncertainty and unknown around it, and to have that support and be able to share that support with everyone in the team has been remarkable. Really helps lift those spirits and keep those spirits high.
All right, let me add one more thank you to that, Doctor.
Thank you.
You be safe out there.
We appreciate it. Thank you so much.
All right.
These are the heroes of our community, Javi, and we support them, and we are glad to see so many other people do. Thank you again to that doctor.